My name is Dr. Stephanie Sammons. I am an OBGYN physician at Mosaic Life Care. Yeah, that's a very interesting question. Obviously, we're not too far into any of this pandemic. We're a year and a half in. We know that the vaccine's been around for about as long. They started developing it as soon as they realized there was a public health crisis that was going on. But it's a vaccine that has its roots from many years ago, from when that initial SARS outbreak happened a long time ago. And what we're seeing now, the ASRM is the American Society of Reproductive Medicine. They've done a bunch of different studies, and none of those studies show any signs of infertility with women trying to get pregnant or that are currently pregnant or having bad pregnancy outcomes. When you sign up to get vaccinated and you get your vaccines, there's a system called vSafe, and they're encouraging everyone to sign up for it. I signed up for it myself with my vaccines. And it asks you if you're currently pregnant or if you've gotten pregnant at any point during their checkpoints that they put out. And the CDC will reach out to you to get more information about your pregnancy and follow you specifically through the course. And all of the information that they've gathered through since these vaccines became available to the public in December, January, have shown no signs of miscarriage, no signs of increased infertility, no signs of adverse pregnancy outcomes in any of the people that have signed up for any of these registries, which are huge at this point because we have so many people that have gotten vaccinated and lots of women have gotten pregnant, either intentionally or not intentionally, during that time frame. I would tell them that we know that there are very bad pregnancy outcomes in women who choose not to get vaccinated. We see it every day. I've yet to see someone admitted to Mosaic that is pregnant that has been vaccinated. Everyone that we've admitted has been not vaccinated. We've had many women that we've had to end up transferring to a higher level tertiary care center in Kansas City because they're so early in their gestation that we weren't able to support the babies if something was to happen in pregnancy where we were going to have to deliver baby early. In talking to the maternal fetal medicine doctors in follow-up at various facilities in Kansas City, some of those moms have better outcomes than others, but there have been cases of moms dying during pregnancy because of COVID, moms and babies dying together because they weren't able to get baby delivered in time, babies that are born too premature to be able to save. So we know that the pregnancy outcomes are much worse in women that are pregnant versus same health status that are not pregnant. I mean, it's a systemic issue. We have breathing difficulties. I mean, there's so many physiologic changes that happen in pregnancy. We know that pregnancy outcomes are also worse in women that have some sort of, they also have another medical comorbidity. So obesity, diabetes, hypertension, advanced maternal age, all of those things increase the risk just in pregnancy in general. So when you add COVID on top of that, it absolutely increases the risk of getting sick and having worse outcomes. Yeah, I would say that the people that write are evidence-based medicine for everything that we do in the OBGYN world. So the American College of OBGYNs, the Society for Maternal Fetal Medicine, the ASRM, the American Society of Reproductive Medicine, so those infertility doctors have all come together and they have all said, looking at the data that we currently have, this vaccine is safe in pregnancy. It has been shown to decrease maternal and fetal morbidity and mortality, that we are not seeing adverse pregnancy outcomes, that it's the best thing that we can do for you and your baby while you're pregnant. In vaccinating women during pregnancy, there are studies that show antibodies in the baby's cord blood at delivery, which is amazing because at this point we don't have a vaccine for kids 5 to 12 at this point, and we really don't have a vaccine for anybody under 5. So if we can do anything during pregnancy to give these babies antibodies that may help them fight exposure to COVID, I think that's great. They're also seeing it in breast milk. So the recommendation So for anybody that is thinking about being pregnant, that is trying to get pregnant, that is currently pregnant, that is breastfeeding, 100% the recommendation is to go ahead and get those vaccines to give yourself and your baby as much protection as you can. Yeah, there are very few vaccines that cause any sort of pause for us in either pregnancy or in lactation. In fact, we give the Tdap vaccine, which is the P in the Tdap is the pertussis, which is whooping cough, and that's been recommended for as long as I have ever been practicing medicine, to give pertussis whooping cough vaccine during the 3rd trimester of pregnancy, so mom can make some antibodies for baby, and baby has some antibodies until they get their own vaccines when they're old enough. We've been recommending that for years, so we know that vaccines during pregnancy are safe. The technology behind the COVID vaccine, it's an mRNA vaccine, so it's the mRNA molecule is not something that's ever going to, it's too big to cross the placenta, it's too big to cross the breast milk. So what you're getting are the antibodies and not the vaccine. It's not, the baby's not being vaccinated. The baby's getting the antibodies through maternal circulation. There have been no adverse outcomes in moms that have been vaccinated. We've seen nothing that makes us even pause about vaccinating moms. We know that the outcomes in women that get COVID that are unvaccinated are poor. We know that. And we're seeing much less disease in women, much less serious disease, no hospitalizations in women that have been vaccinated to this point at this hospital. So there's a growing body of evidence that the COVID virus attacks the placenta, which can lead to growth restriction for the baby. There's some increasing evidence, especially with this Delta variant that's going around, that there is an increased risk of preterm labor and even stillbirth, which means that we essentially have a baby that's died in utero. I have a friend that's a pediatrician in Kansas City, and he currently has 2 babies in his care that have lost their moms. They're young, in their 20s moms were lost to COVID, and now babies don't have a mom. That's a huge impact as well. Whether we are able to save mom or to save baby and not save the mom, we still have had someone affected by COVID, and now this baby's gonna grow up without a mother figure because they were lost to COVID and they weren't vaccinated. Something that we hopefully could have prevented with a vaccine. There are no studies to date that show any sort of negative outcomes to mom or to baby with vaccination. So I myself am 37 weeks pregnant, and I have been vaccinated for COVID-19. I did so knowing that there was a growing body of evidence that this was absolutely going to be safe and the best decision. Coming to work throughout the pandemic for the last year and a half it's scary. I have 2 young children at home. I was afraid every day that I was going to bring something home to them, that I was going to get something and maybe be asymptomatic and not even know that I was a carrier, and bring something home to my kids. And there's no vaccine in sight that I can put a timeline on for my youngest, who's 2.5. So when we decided to go forth with a 3rd pregnancy, it was a hard decision because I had to weigh lots of things in my life. I'm getting a little bit older. My kids are at the perfect age. They're 5 and 2.5, and if we were going to add another sibling to the family, it was the right time. But we were also in the middle of the pandemic. It's just it's a very difficult place to be as someone that's thinking about getting pregnant, that's trying to get pregnant, that's currently pregnant. It's a scary time, especially with all the restrictions on labor and delivery, and we're down to 1 visitor, and it's just not like it used to be over there where we could just have visitors all the time. But when we decided that yes, we're going to go forth with this next pregnancy, as soon as those vaccines were made available, the first thing I did was jump on board to get my vaccine, because I knew it was the best thing that I could do for myself, the best thing that I could do for this baby, the best thing that I could do for my kids at home to prevent bringing anything home to them, to keep my family as safe as possible. It's so easy to be bombarded by the plethora of information and research that we see on social media because it's the easiest place to find information. American College of OBGYNs, the Society for Maternal Fetal Medicine, the American Society of Reproductive Medicine all have open websites. You don't have to be a member to any of those organizations to get their evidence-based recommendations that are easily available on any of their websites. The CDC is an excellent source because those are the people that are also collecting that V-Safe information, and they put out regular updates. I mean, this stuff is updated regularly on their websites, and you can read. It's all open access, and you can absolutely access that information at any time. And I am regularly on those websites finding the newest information so I can print it out and hand it to my patients in the clinic and do my best to help convince them that this vaccine is the best thing they can do for themselves and their baby during their pregnancies. I just wish that people, I just wonder if people saw what we saw on a daily basis, if they saw how hard it was to get these moms transferred because the beds are full in Kansas City. So then we're worried about delivering these early babies here where we have the capabilities to deliver early babies, but we know that delivery outcomes are best if these really early babies are delivered at like the level 3, level 4 NICUs. And it's stressful as an OBGYN. Like I can deliver a baby at any point. It's not a skill that I don't have. It's the aftercare for baby that's really important. So when these moms come in super sick and we can't find a bed for them in Kansas City, and then we're worried about having to potentially deliver here, and then baby gets transferred, and then mom's stuck here after delivery until she's well enough to go home. And if she's sick enough with COVID that she's being admitted to the hospital, it could be several days, several weeks until she's well enough to get home. And that's one of the big things that's made it very difficult. Not only transfers for COVID-related issues, but preterm labor transfers. And the last couple times I've been on call, and I've needed to call to transfer like a preterm labor or someone that's too early to deliver and had broken water, I've had to call a couple different facilities because everything's just full to transfers because they're full of their own patients that have just benign pregnancy issues, and they're full to COVID transfers as well. So it just makes the practice of medicine a little bit harder these days. I just wonder if the general population was to see these moms, to see how sick they are, to see how sick these early babies are when they're delivered, if that would change their mind. I think sometimes it takes a personal experience with someone they know that eventually gets COVID and they see a less than ideal outcome. And sometimes that helps to change their minds, but we practice what we preach. I am an OBGYN. I'm 37 weeks pregnant. I've been vaccinated. And I take every precaution in every point in my life to prevent getting sick and to prevent bringing something home to my family or, to bring it to my fellow physicians and coworkers at the hospital. It's just a bad place that we're at right now, and we're using the evidence-based medicine that we have to make the best decisions for ourselves and our patients.